Right, so risk factors. So the things we've got to consider is, are we taking in the right nutrients? Are we taking in the right hydration? So thinking about that, if you put the wrong fuel in a car, and I don't know if anybody's done that before, put petrol into a diesel, then it will get you about half a mile down the road and all of a sudden it goes chuk, 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 chuk and conks out. So it's not a good thing to do, because it means you've got to then have a mechanic involved who's got to strip parts out, and it's got to be all drained out, and it's quite expensive. Well, it's exactly the same with your diet. If you put the wrong things in, i.e. if we've got people with leaking wounds, whether it's lacerations, leg ulcers, whatever, that are leaking high volumes of exudate with low viscosity, then the protein leaking out needs to be replaced to get the healing to occur. So please consider how much fluid is coming out of this patient, how much needs to go back in. Do I need to put protein supplements in? Have they got access to the right nutrients to enable them to be able to heal? History of skin tears. Again, whether it's skin tears or any types of wounds, your skin has a tensile strength of about 70% after healing. So wherever the wound is, whatever the wound is, whether it's a leg ulcer, a pressure ulcer, a skin tear, whatever, you've got a maximum of 70% tensile strength. So that means you are going to be at risk of breaking down if you do not protect again. Drugs and medication that may cause, it says, disorientation and skin thinning are, give me an example. Steroids is probably the most obvious one. What might be something that induces ulceration of the skin? Can you name that one? Do you want me to give you a clue? Yeah. It helps that. Nicorandil, somebody said it, didn't they? I heard them say. Yeah, it's Nicorandil. Be very, very wary of Nicorandil. It's a cardiac drug. It's an old timer, if you like, from a point of view, but be very wary. Nicorandil does induce ulceration right near your anus. Now, if people say to you, oh, I've got this circular ulceration right near your anus, it's highly unlikely to be a pressure ulcer, because you've got your buttocks that support you. But if you get a circular ulceration right near your anus, it could be Nicorandil induced. So always be wary, always check your medication. There's also evidence to suggest it induces leg ulceration as well, so just be wary of Nicorandil. Immobility causes susceptibility to the skin. So again, it's not just your immobility with regards to, it's how you walk. So if I'm walking and I'm doing the alley shuffle, if you like, my ability to trip, slip or fall over something like that, you put your hand out, you break, you fall, and I've been through that circumstance unfortunately on a cycling accident. You put your hand out, the next thing you fracture your clavicle as well, but at the same time you lacerate your hands, because that's the first point of contact. And having done that myself, falling off a cycle, I lacerated my hand, lacerated my arm, and I lacerated a big V in my back. Now I remember them in York. I'd only got as far as Malton. I was doing 100 miles a day. I only got as far as Malton, so it was a good get out of jail card. But in actual fact, I ended up in Resus. They thought I'd broke my neck. Now, when they'd sorted me all out and everything, they said, oh, you've got this big laceration on your back and you've got these lacerations on your hand and your arm as you tried to break your fall. They said, don't worry, we'll go and get you some dressings. I said, oh, aye, will you? So he said, yeah, we'll get you these real nice dressings. They came back with, no, I was beyond steri stripping. It was a massive V in my back. I looked like that advert for sure, you know, the big tick. A pad? A continence pad. No, not a continence pad. I hadn't lost my bladder. No, they came back with a big sheet of gelinette. So I said, I'm really sorry, but that is not going on my back. So they said, what do you mean it's not going on your back? So I said, because the warp and the weft, i.e. the way it's knitted, will allow for granulation to go through. It will stick to my back, and when it then needs to come off, I will be in agony. So they said, oh, and what's your experience then? So I said, I'm the TVN for the Next Door Trust. So they said, oh, we'll go and get you something. Came back. What did they come back with? Bit of Bachygra. I said, no chance, that's not going on neither. So they said, what do you want? I said, I want a silicone-based dressing, please, or a lipocolloid if you could. So they said, came back to me. I said, really sorry, we haven't got any of that in stock. I said, don't worry, I've rang my wife in the meantime. She's on her way from Humber. She had, at this point, I was in Resus, new Volkswagen Golf, reversed it into a brick wall. Very expensive accident that was for me. Also consider your comorbidities. So what are the chronic disease? If patients suffering with dementia have got the same visual context, are they going to be at risk of slip, trips and falls? again, I'll use the example very quickly of my poor gran. She's been dead for 15 years now, but I remember her being discharged into this care home, which I didn't actually know about at the time. I went round on the first night, I'm not kidding you, there was cables hanging from the ceiling across the floor, and they said to me, oh, it's going through a renovation. I said, you can't have people expected to walk about like this. She's got vascular dementia, she's going to have trips, slips, falls, lacerations, etc. So they said, what do you want me to do? I said, I want you to get me the owner of this place. Oh, he's abroad on holiday. So I said, fantastic. I said, well, get hold of him, because she's not staying in here another night. Well, not staying in here tonight. So please be wary for that if you can. Smoking, again, why does smoking affect it? Well, as it says, it accelerates the aging process, but it's that microcirculation, because it caused the hardening and the narrowing, and your artery's ability to carry the blood to the peripheries is restricted or reduced, then it causes the aging process. Good job I didn't smoke, isn't it, with these lines, otherwise I'd have been in deep doo-doo. So again, please bear it in mind when you're trying to look at that holistic picture.